Welcome, everybody, to the 2021 Lewis Katz School of Medicine Story Slam. I'm Mike Vitez, the Director of Narrative Medicine at the Lewis Katz School of Medicine. Some of you may not recognize me because I'm wearing a tie, and it's been the first time in a year, but I thought for this event I would go all in your honor, in honor of the presenters. I want to thank you dozen presenters and storytellers tonight for being our Story Slam Zoom pioneers. I want to thank the audience for attending. To borrow a line from the late, great Ed Sullivan, tonight we've got a really good show. And if you don't get my reference to Ed Sullivan, well, I guess you got to look it up. Here's how the Story Slam works. You've seen the lineup. It's a great lineup. Each storyteller gets 5 minutes to tell a story with a modest grace period. At the end, there will be a poll, and you can vote for the story you liked best. I don't envy you that task of choosing because they're all so good. Trust me, and you'll see. They're very good, and it will be hard to pick. We've got a nice mix of faculty and students. They're arranged in no particular order. Dr. Erin Kamak, formerly Dr. Naruski, will be our last presenter. She had clinic today and didn't want to risk being late, so she asked me if she could go last, and I promise you her story is worth waiting for. Now keep in mind that nobody here is a professional writer, a storyteller, but everyone here and most of you out there and listening works on the front line of medicine. And it's been an extraordinarily difficult year, as evidenced by our inability to gather in the MERB and do this Story Slam in person. And on that note, I'm really sorry I can't feed you Tierra Colombiana and the chicken and rice and plantains, which is really as why so many of you come to the Story Slam. And I'm hopeful that next year we can bring it back. And maybe some of you were inspired and went and got takeout from Tierra Colombiana. And I guess I should have. I should have. In any case, the theme for tonight is I love medicine. I wanted to choose something that would remind us, even in these times, what we love about medicine. But each storyteller has the latitude to interpret this theme as he or she wished or ignored altogether. As you know, I love stories. I believe in the power of stories to heal and inspire and bring people together. And I believe stories change the world. And events like this celebrate the role and the importance of stories in medicine. They remind us why we love medicine, why we chose it as our profession, how hard it can be, and how rewarding it can be. And Story Slams and events like this underscore our own humanity and the humanity of our patients. I just want to thank Dr. Daly for his support. I want to thank all my colleagues in Student Affairs, Diane Butera, Lisa Duncan, Jerome Wright, Mickey Marcassani, for their help and support. And especially I want to thank my partners in crime in narrative medicine, Dr. Doug Reifler and Dr. Naomi Rosenberg. And Naomi 2 weeks ago had twin boys. I want to, let's all congratulate her. She won't be with us tonight on the Zoom. She has other things to do, but we're recording this so she can watch it later. I also want to thank Daryl Asbury, our technical support specialist, who has made this Zoom extravaganza possible. On that note, I say let the show begin. Our first presenter tonight is Sister Jocelyn, a Catholic nun who's also Dr. Edithel. She's a hospitalist at Temple, a great supporter of narrative medicine. She bravely agreed to go first tonight, and I thought that her story set the perfect tone for the evening. Her story is titled, My Name Means Joy. Take it away.
Thank you, Mike, for having me. I do so love Story Slam. I do wish there was food, but I will see if I can get pickup. So I shall begin.
Okay.
My name means joy. After many years, I finally found out the meaning of my name. In college, we had to research our names, and initially I thought my name meant grace, and then I found out actually my name means joy in the middle place. So I found out that my style is definitely my smile. But what happens when Joy, or Dr. Joy, loses her smile? In fact, this has been a challenging year for so many of us. And there were times that I was on the brink of losing my identity. In fact, my identity is often the juxtaposition between two different titles. I live in the world of the slash. I am MD, PhD, sister, doctor, and my patients this year walk that fine line between alive and dead. I went into medicine, like so many, to help others. But unlike others, it was not until my last few years of medical school, in my clinical years, late into my clinical years, and even into my residency, that I fell in love with medicine. I love the diagnostics. I feel like I'm a detective. I have diagnosed difficult diagnoses such as ALS and possibly even porphyria. I love the connections with people. Recently, I was reminiscing of that joyful day when the Philadelphia streets were green with Eagles paraphernalia during the Eagles parade, the Super Bowl parade. We were shoulder to shoulder with our fellow Philadelphians, and we crowded into the streets and the subways, rejoicing. And now, there is that invisible line of social distancing. During the height of COVID, I could no longer touch my patients without some fear. It was the thin line of the face shield which both allowed me to see my patients and separated us. In fact, I went into that fearful time thinking that I was like St. Joan of Arc, who would heroically and valiantly, and maybe naively, go into battle with the virus. In fact, I did my PhD in antiviral drug design. I had the joy of discovery. MD meets PhD. But as the weeks turned into months and I lost family members and friends and patients, the joy began to seep out of me, and I began to look like my ID card, a sad, mangled piece of plastic, which still works after I put it in the washer and the dryer. Well, even today I got locked out of the parking lot. When joy loses her joy, what can help? It's connection. I recently had a young female patient who had severe coronary artery disease and was going to have a left heart catheterization in the morning. I ran down to see her before she was being wheeled into the cath lab, and I waved hi to her. We had chatted a while the day before about all the things she had overcome with so much illness, but she was so positive. That night, I remember it so well, I got a call from an attending saying, "Your patient, I'm sorry, she coded." My heart sank. I don't know if it's because I saw her. I saw me in her. Her skin was dark and so is mine. I identified with her. Is she still alive? I asked. Well, they got her back, but she was down for 15 minutes. 15 minutes? Well, now that's an eternity in a code. I was home when this happened. So suddenly I thought, maybe my slash should go into effect here. After all, I am sister/doctor. So as I went through my social rounds of calls to friends and family, I would gently share that my patient was very sick. Please pray, I softly mentioned. After all, in my 11 years as an MD, I've seen so many codes. I knew hope was thin, and my joy was thinning out. I'm not sure why that patient stood out. Maybe my identity as a healer was tarnished by COVID. Maybe my heart couldn't take another death. Maybe I was, like so many families, looking for a miracle. The next day, I found out that she survived the night. The days passed, and finally I saw that she was out of the ICU. Did she have an anoxic brain injury? How was she? Did she remember anything? I hoped, and I prayed, and I went into the room to see her, and she said, "Hi, Doc. How are you?" I was shocked. She survived. She was able to speak. In fact, my gift of healing was shocked back into practice. Now, this really comforted me. Now, we live in a world of odds and predictions, but for me, this was my patient, N equals 1. This is where sister met doctor, and she walked on that slash between alive and dead, and she gave me back my joy. Now, underneath my face shield and my mask, I got my style back. My eyes dance behind my PPE, behind many slashes and titles. I'm still a joyful healer. Thank you.
Wow. Thank you. When I asked for a leadoff, that was a fabulous leadoff story. What a beautiful story. I love the whole notion of the slash MD, PhD, sister, doctor. And the story was so heartfelt. Thank you for that, sharing that. And thank you for going first. Really beautiful. Next up is Will Schiffeling. The soon-to-be Dr. Schiffeling has been a devoted supporter of our narrative medicine program all 4 years. He vowed to do a story slam before he graduated, and he's good to his word. This is his final spring. He stepped up. His story is titled Trichocyanosis. Take it away, Will.
Thank you. Just wanted to reiterate Sister Edith Hill's words of thanks for hosting this event. It's always a pleasure. A middle-aged woman was brought back to room 5. After she entered the room, I joked with my classmate that she was going to be complaining of blue hair. The medical diagnosis was obvious: trichocyanosis. What is trichocyanosis, you might ask? Simply the word the medical field created to diagnose blue hair. And who is the medical field? Well, really just me. Trichocyanosis is a common condition amongst the TikTok generation, but less prevalent amongst those older than myself. Although the diagnosis is obvious, the possible precipitating factors are a bit more complicated, especially for those in middle age. Had she recently lost a bet? Did the constraints and confinement of COVID cause her to consider hairstyle alternatives? Was a midlife crisis manifesting itself in a rejection of her natural melanin? Or did she simply prefer blue hairs to white ones? A bit later, I followed one of the dermatology residents, Dr. H, into the trichocyanotic patient's room. Room 5 is tucked away at the end of the dermatology clinic, and the thermostat is set in response to how cold it was that morning, which meant any more than 10 minutes in there and I'd be sweating profusely. Although my 4 years of medical school at Temple have prepared me in many ways for becoming a physician, I still am unable to predict 100% of the time what our patients will be concerned about. Miss K was one of those exceptions, as her complaint had nothing to do with her blue hair. After recently being jerked in her car, she had grown a small lump on the left side of her neck that was bothering her. Dr. H then explained the procedure of removing her lump and obtained consent. Having observed me now in previous patients, Dr. H entrusted me to inject her lump with lidocaine and set her up for a biopsy, so he promptly left the room. I gathered the necessary supplies, set the room up, and prepared the patient for the procedure. Sitting on the exam table, I asked Miss K if she would prefer me to tell her when I was injecting lidocaine or just do it. "You can tell me," she said. "If you have ever had a thoracentesis or know what that is, they hurt like hell, so this is nothing." What a relief, I thought. A patient who can handle pain. But I wondered, why had she had the thoracentesis? I doubted the cause was trauma, as most of the trauma victims are not middle-aged women. Having seen no patients with either cirrhosis or heart failure in derm clinic, I doubted that was the reason. Maybe she had a pneumonia or a PE, and one could never rule out malignancy. Alrighty, little pinch and a burn, I said before sliding the needle in superficially. Son of a bugger! Oh, you mother humper, she yelled while holding completely still. I'm so sorry. I know it's painful. Are you doing all right? I asked as I withdrew the needle after regaining my external composure. Internally, I was freaking out. The room's oven temperature and my sympathetic response were causing the beads of sweat running down my face to turn into rivulets. Thoughts were churning in my head. Did I do something wrong? I mean, she said she would have no problem handling this. Dr. H is going to think I harmed the patient. She called me a mother humper? What are the other residents and attendings thinking that can hear her? And lastly, why did I go into medicine? Yeah, I'm okay, she said. That burn is the worst. So I carried on with continued shrieks from Miss K. And once I finished, she apologized. Sorry, I'm trying to watch my language. Oh, no worries. It was completely fine. Sorry for the pain, I responded. Growing up a member of a bar of soap mouth washing household, I understand the avoidance of expletives. But to be honest, I think I would have preferred the curse words in this instance. While waiting for Dr. H to return to remove what we thought to be a lipoma, Miss K and I started chatting. Where was I from? Where was she from? How was she getting on with COVID? Several minutes later, Dr. H returned to the room and quickly started removing her lump. I was happy she could not feel a thing. When Dr. H finished, he left me to bandage her up. We picked up our conversation where we left off, and at one point she made a side comment that she was sorry for how much she was sweating. Menopause is the worst, she said. I advise you to never go through it. I'll do my best, I retorted. These chemotherapies they're giving me cause me to go through menopause. Lupron, I have metastatic breast cancer. Ah, now the thoracentesis makes sense. And I am officially a terrible person for having joked about the trichocyanosis. She timidly asked me if I had ever taken care of a cancer patient before. Sadly, yes, I said, thinking of my last patient who had been hospitalized as he started to lose the fight against his mutated cells. She went on to inform me that at her last checkup, there had been no new metastases or growth of her current mets. That's great. I hope that continues. Thank you. I applied a small amount of Vaseline and a Band-Aid. I gave her some gauze in case there was too much Vaseline, instructed her how to care for the wound, helped her sit up and gather her belongings. Before leaving, she said kindly, "Don't lose your beautiful bedside manner." I'll try not to. And with that, she left room 5 in the dermatology clinic. I love medicine because in the same patient encounter, I can go from asking myself why I chose to become a doctor to having a pretty good answer.
Thank you, Will. Beautiful job. I love your sense of humor. I love your courage for sharing. And I love how you went from despondent to sublime all in the same patient visit. You know, it's great. Thanks for doing that tonight. Next up, we have Hannah Rose Roach, a second-year medical student and a faithful attendee of our student narrative medicine workshops. Her story is titled "My Nano." Is it Nano? My Nano? My Nano?
Oh, no.
Okay.
No. But
No.
Excellent. Yeah, no, that is perfect. All right. Hello, everybody. And yeah, just thank you all for being here. And thank you for listening. All right. I don't think anyone loves medicine as much as Franco Mario does. My grandfather breathes medicine. I can often find him sitting among the towering stacks of journals, articles, and textbooks about his office. Sometimes I worry they'll tumble down and Nono, as we call him, will be trapped in his office, but frankly, he'd love that. Nona has to yell Franco 6 or 7 times before you hear his feet creak on the stairs down for dinner. I don't always know how he could love it still. Medicine has not been kind to him or his family. As a Jewish family living in Italy, he saw his father's title of physician stripped away with the rise of anti-Semitism under Mussolini, who my grandfather not so affectionately refers to as his travel agent. And while my Nono claims his good health is entirely due to his eggy a day, he has seen his patients through the hardest disease courses and seen many die far too young. This past January, he turned 85. He is a gynecological oncologist in New York and continues, even during COVID, to go into the hospital on a weekly basis only. He says patients still need chemo, so he goes. He was going in throughout March at the height of NY cases, and my mother almost murdered him, but he was still so concerned about his patients. His department throws him retirement parties every 5 years. They started at 70, and I don't suspect them to end anytime soon. This most recent one was 85. See you at 90, Nono quipped. His chairs have been given to younger faculty. He's aged out of them. But truly, I don't think he ever wanted to do medicine for the title. It's his patients, the ones he spends hours with. When a patient passes, it's not uncommon for my grandfather to stay close to the family he grew to know, swapping emails every so often and hearing about all the ways a life can change after a loss. Nono loves to speak the language of medicine. When I'm in New York, I'll stop by to say hi and check in on my grandmother, and he will simply have to show me a case study or two. He'll leave me with a textbook and ask me to pull up the anatomy app on my phone so he can see the lymphatics of the breast. He tells me he learned medicine from paper in the 60s. He trusts medicine. I don't always know how he can. But when my grandmother was sick, he spent every minute in her hospital room. He moved from the computer, often typing up his own patient notes, to at her bedside, carefully studying the ventilator, to asking for her advice on a bridge move, even as she lay asleep and intubated. He trusts medicine, and most importantly, he trusts the strength of the patient. He just knows what they are capable of. I sometimes think I could never love medicine like he does. Could I ever scour books for decades and decades? Could I collect journals until I'm out of room? Could I devote 60 years to medicine? He was a doctor before man landed on the moon. I can't help but wonder where the world will go while I'm a doctor. In the end, I think Nono will never stop medicine because he will never stop caring. And maybe that's the greatest legacy I can inherit. Thank you.
Beautiful, beautiful job, Hannah. We can all certainly feel your love and admiration for your grandfather and appreciate what kind of doctor he must be. I love the image of all his books and journals collapsing on him and him being happy about it and just, trapped there and loving it. Thank you for sharing that story. Up next is Erin McGillivray, soon to be Dr. McGillivray, who wrote a version of this for our literature and medicine elective. Props to Dr. Reitler. It's been a great elective for fourth year students. I loved what she wrote, and she bravely agreed to share it with all of you. She modified it, and here it is. Her story is titled Mornings with Ms. L.
Thank you so much, Mike, for inviting me. This is actually my first Story Slam, and I was reflecting on when I was a first year, just how much I admired everyone who was brave enough to do this. So I thought it was fitting that I should do this before graduation. Before I get started, I just wanted to say congratulations to all the fourth years. We submitted our rank list today. Hopefully everything is in and done, and it's a huge accomplishment and relief for all of us. So congrats to all the fourth years out there. And then without further ado, I'll start my story now, which is titled Mornings with Miss L. It was the beginning of third year and I was on my surgery rotation. Every morning, my alarm would go off at 4:30 a.m. and I immediately would start thinking through the morning's tasks. On the 5 a.m. train, I would exchange knowing, worried looks with my classmates, also consumed by their own internal checklists. Once at the hospital, I would rush from room to room, peppering patients with the same two questions. Did they poop yet? How was their pain? I then would try to quickly and painlessly change their dressings, which is the worst possible way to wake someone up. By morning rounds, I would be in a full sweat, trying to recite and remember what I had learned that morning, and then I would stumble attempting to answer the follow-up questions from my attendings. In the operating room, I willed my hands not to shake and had moments of panic whenever I was asked to participate. In general, I felt very out of sorts and was super focused on my own experience. Would I ever find my own place in the hospital? One patient I met during this time was Miss L. She was notorious on our team for being a difficult patient. She rarely agreed with our plans, was always asking to leave the hospital, and would sometimes threaten staff physically because she was so frustrated. Miss L was in the hospital for an infection that kept returning because of her uncontrolled diabetes. She required multiple painful debridement surgeries a week and therefore multiple painful dressing changes as well. I was so focused on getting through my stressful mornings that I resented her moodiness and the extra time I had to spend with her. As the days passed, I grew more accustomed to the rigors of rotations and started to put less pressure on myself. I slowed down. I tried to let go of the checklist in my head and started to ask more questions. In short, I started acting like myself and less like a robot. With Miss L, I would sit on her bed instead of running out of her room every morning. I asked her about her life to help distract her from the pain of the dressing changes. Where did she live? It was impressive to see how much she perked up even with small acts of engagement. It made me feel guilty for being so self-obsessed with my performance on a rotation when this woman's life was happening right before my eyes. In our conversations, I learned why she had difficulty controlling her chronic illnesses outside of the hospital and how hard her life had been. She struggled with substance use that led to her losing her job. As a result, she had difficulty paying for her insulin and other medications. Miss L also shared that she was sexually assaulted when she was younger and had a hard time trusting anyone as a result. We also had a lot of lighter moments too. One morning, she told me about her imaginary friend she had as a kid, and it became a running joke between us. She would also shamelessly flirt with the male members of our team and then try to give me fist bumps as if I was in on her bad behavior. I saw her in a totally different light after learning about her life and having context for everything going on with her health. After a few weeks in the hospital, she was finally ready to be discharged, and the team wanted me to break the happy news to her. I took the stairs 2 at a time and eagerly walked into her room. I told her that her infection had essentially healed and she could go home that very afternoon. To my surprise, she started to cry. "I don't want to go," she said. It was very sobering to experience. Clearly, the challenges that awaited her at home far exceeded the pain she had to endure being poked, prodded, and operated on in the hospital. I'll never forget her begging me to stay at Temple one day more after her wanting to leave for weeks. Although I did understand, at least in part, because of our morning conversations. We ultimately talked about the isolation she felt at home, the many family members who were going to help her, and really all the people who cared about her well-being. I'm not sure if I was able to make her feel better, but I have since helped take care of other patients too, who are fearful to leave the hospital because of social and economic problems that await them outside. It always makes me take pause. How are there so many people that would rather be in the hospital than at home? As a society, can't we do better? I always have fond memories of working with Miss L because she helped pull me out of the robotic monotony I was in and showed me that I belonged in the hospital. More importantly, she proved how transformative it can be for both patients and providers alike when we are present and when we are personal with one another. I hope to hold on to these lessons as I grow into my new role as an intern next year. Thank you, guys.
Beautifully done. Beautifully done. Thank you, Erin. You know, I love the lesson of your piece, you know, that our patients are our best teachers and how important it is to slow down. Well, thank you for sharing that. Thank you for stepping up. And I'm sure you're going to do great as an intern.
Thank you so much.
Up next is a former Story Slam champion, Katya R., also soon to be Dr. R., in a couple months. Katya has been involved in narrative medicine since she walked in the door at the Lewis Katz School of Medicine, and I will miss her. Her story, as of this afternoon, was untitled, so I leave it there and take it away, Katya.
Okay, so my story, it's more of like a poem thing, and it was kind of inspired by residency interviews, and it still doesn't have a title, so anyway, I'll just get to it.
All right.
Tell me about yourself. It's a question I've been asked 17 times in the last 4 months, and it always throws me for a minute. Where do I begin? Do I start with my grandmother's stories? How her words lit a fire in my heart before I even knew what stories were? How she wove the history of our little carpet mill town like the looms themselves, dyeing the air as vibrant as the Chuctanunda Creek. poisoning everybody a little bit at a time, but who could have known all the suffering yet to come? Or do I start with my dad? How in every difficult patient with sparkling eyes and lightning round questions, I see my father, running barefoot through the mountains because shoes were for school, just fast enough to beat the system that gave him a tent to raise his children in when determination barely gave him the clothes on their backs. Or do I start with me? The speech. My name is Katya. I grew up in upstate New York in a small flat downstairs from my grandparents. I grew up in an old factory town where everybody gets cancer. I grew up thinking I'd never get to go to college, but here I am. I grew up. Or what about my old work friends from the restaurant or from the Roy Rogers by exit 27 on the New York State Thruway? Do I start with how the faces of patients found down in the field remind me of theirs? Too drunk, too high, too young to be lost. Their wild laughter and DWIs and custody battles and drug deals and weddings and funerals all cacophonous in my ears while I sprinted away and left them all behind, or is that too dark? I'll polish it up a little. My name is Katya. I've been a lot of things, and now I'd like to be a doctor, an oncologist specifically, you see, because everyone I grew up with seems to get cancer, and maybe it could be from that brightly colored creek. I see. Well, why are you applying into internal medicine? Oh, I love medicine. I love medicine because it speaks to me. As students, we're taught that medicine's cadence is labs, scans, regurgitated facts, mechanisms, and complex plans that you should know more than everyone around you. Quick, spit it out, but I disagree. Medicine really speaks if you just put your head down. Drown out the incessant machine beeps crowding the people dying for your attention. Put away your notes, your phone, up to date, the latest intervention, that prior authorization that nameless faces 1,000 miles away used to deny someone you know the rest of their life to live. Forget for a second that you have to be the one to tell them. Just put your head down, walk into the room, breathe, and listen. Listen with everything you brought with you today. Where do you see yourself in 10 years? Okay, this one is tough. It's tough for a girl from a place where 10-year plans are luxurious. I see myself. I remember when I told my parents I wanted to go to medical school, and my dad asked me what would happen if I failed, if I was reaching too far this time. So in 10 years, I see myself living dreams in a world no one he knew ever could have belonged to. I see myself and my nieces pivoting from wanting to be princesses to wanting to be doctors, my hands moving the world for them as I reach for something that never should have been mine. I see myself. And the friends that drugs and cancer and $3 an hour and GED classes and single motherhood and solitude left behind, I finally see myself.
Wow. I'm going to think long and hard about what to title that. That was beautiful. Thank you so much for sharing that. And you know that she did today, everybody.
Like 20 minutes ago.
I know. But you know that's what a story slam is. Just tap the vein and let it go. Thank you so much, Katya. Our sixth storyteller is Maria Saraf, also a fourth-year student, soon to be Dr. Saraf, who wanted to do a story slam before she graduated and mustered the courage to here she is. You know, doctors, they're used to doing things that are hard, and you know, public speaking and sharing like this is not easy. And I thank you and I applaud you for doing this. She shares this story, I guess I would say, about changing perspectives, right? And it's titled, I Am 26.
I was 7. My sister and I were carelessly playing on the old swings in our backyard when our laughter was interrupted by a loud thud. We glanced over to the source of the sound, gazing beyond the rich green lawn to the cold marbled floor of our back porch, where our eyes fell upon my younger brother. He was on the floor, quite still. I don't remember running over. I don't remember calling my mother for help. Those were relayed to me in stories told in the future. All I remember is the blood on the floor. It was more blood than I had ever seen before. But it wasn't surprising, though. I mean, my brother was always getting hurt, and I was used to it by now. And as usual, I saw him return the next day, a few well-placed stitches on his forehead, and a big smile on his face as if nothing had ever happened. I was 9. My older sister had been in bed for a few days. Not her usual bed, but the guest room bed downstairs where a few people had already been in to see her. My parents told us we couldn't bother her because she had to rest. They seemed worried about her, but she was sick and just needed some medication. That's what happens to sick kids. They get better with medicine. Regardless, my brother and I used the decreased supervision to our advantage for some unfettered play, and within the week, my sister was able to join us for more shenanigans. I was 11. We had to go see our grandmother on short notice because she was ill, so my parents pulled all three of us out of school so we could pack and leave. It was a very long drive from our city to the destination, and we didn't really take many breaks. My parents seemed serious throughout the journey, though, and it was towards the end that we found out why. My grandmother didn't live long enough for us to see her alive. We arrived at her funeral, filled with countless unrecognizable faces, mourning for a person I had expected to see very soon. It was the first and only time I had seen my grandfather cry. The whole situation felt very unexpected, but I remember thinking it was probably from old age, because after all grandparents are old, right? Now, I'm 26 and just 2 months shy of graduating medical school. In these last few years, my childhood memories have come across some new visitors, diagnostic algorithms, and medical jargon. There is a seamless blend as the old greets the new, shining a light of clarity on the events of the past. When I was 7, my 6-year-old brother fell headfirst onto the marble floor from a 3-foot-tall container. My mother applied pressure to the wound on his forehead while my father rushed home from work. There were no CT scans available at the hospitals in the area, so they had to rely on serial neurological exams to evaluate for head trauma. He did not have focal neurological deficits and was discharged for further observation at home. When I was 9, my 11-year-old sister contracted typhoid and was being treated with a fluoroquinolone, an antibiotic, as it turns out, that she was allergic to. She almost went blind from the increased intracranial pressure, which was only caught when she started complaining of double vision. When I was 11, my grandmother passed away at 62 years of age due to complications from untreated heart failure in the setting of pulmonary hypertension from undiagnosed obstructive sleep apnea that she had had for decades. No one had ever taken her complaints seriously. And now I am 26. I view injuries, illnesses, and deaths from a medical lens, but I often think back to how I used to experience them before I learned the language to describe them. It reminds me of why I love medicine, because behind every case is a person who means something to someone. Because behind every case is a brother, a sister, or a grandmother who deserve a fighting chance. I am 26 for now, and as that number goes up each year, so will the countless cases I hope to view through a mixed lens. Thank you. Katya, that was a tough act to follow. I hope I did half as good a job.
You did a beautiful, it was a tough act to follow, but you did a beautiful, beautiful job, and you showed so well how stories matter and how, you can appreciate what goes on so much more when you know the patient's story and you listen. That was a beautiful job. And Katya's just lucky she doesn't have to follow you. Thank you for that. We are halfway through. So everybody, I'm going to, stretch, take 5 seconds. They're great. You can tell I told you would all have a difficult time judging. And next up is Dr. Larry Kaplan, a general internist, beloved teacher and clinician, an avid biker, which has nothing to do with his story, but I just thought I'd throw it in. Dr. Kaplan has also been a big supporter of narrative medicine at the Lewis Katz School of Medicine, and I want to thank him for that. He's interpreted tonight's theme perhaps with a little more sarcasm. His story is titled, "It's Only a Pinch of Valium." Take it away.
Thank you, Michael. I have to say I'm in awe of all my colleagues who have spoken, and for those of you who will be speaking. I began seeing Betty and her husband, Ben, 16 years ago when one of my colleagues retired. They were both in their early 70s and healthy. Ben still taught graduate students in physics, and Betty volunteered at a local school, and they went to Florida in the winter where they hosted visits from a cadre of children and grandchildren. I'd see them in the office twice a year where I take care of their aches and pains and their chronic medical problems. Betty had elevated blood pressure. In the office, it was probably white coat hypertension and long-standing anxiety that she took an occasional mother's little helper. She had been started on 2 milligrams of diazepam as needed by one of my former colleagues almost 40 years ago. She rarely took it, and a review of my chart showed 7 separate prescriptions over those 16 years. I discussed the possibility of alternatives to treat her anxiety, therapy, meditation, even starting a preventative medication, but she was reluctant to change what always had worked. So every few years, I'd write a new prescription for diazepam, 2 milligrams, number 60, used twice a day as needed for anxiety, and no refills. 7 years ago, my practice transitioned from paper to electronic health records, and I began to e-prescribe. When I first clicked to order Betty's diazepam, I got an alert notice. These drugs are dangerous to be prescribed in the elderly. I paused and then contemplated the risks and benefits of continuing. Diazepam is on the Beers criteria list, and there are better options. I've taught that list from clinical decision-making to medical students and residents for over 20 years and knew the data from a scientific viewpoint, but now was confronted with applying it to a patient. I turned away from the computer, looked at Betty and said, I just want to go over the alternatives to Valium again. After a short conversation, I clicked through the warnings and refilled her prescriptions. When Pennsylvania started the Physicians RX monitoring program, I had to check that Betty was not getting multiple scripts for controlled substances and that I was not contributing to her substance use disorder. I logged onto the database, put in her information, and clicked submit. No records found. I changed the date field to include the last several years and clicked again, received the same response. I looked at a prescription record, and diazepam was only listed in the historical record. The last time I wrote a script was 7 years ago for 60 pills. I chuckled to myself and reordered the diazepam. 1 week later, I received a fax from the patient's prescription benefit company telling me that her diazepam was denied. I had not provided appropriate documentation nor gone through the appropriate procedures to prescribe such a dangerous drug. I had not documented that she was in psychotherapy or tried more appropriate anti-anxiety medications such as an SRI. I cursed to myself, wrote an addendum in my chart note detailing the history of her anxiety disorder and its treatment, and faxed it back to the prescription plan. 48 hours later, I received another fax denial. I hadn't followed standards of care. By now, I was livid. When my office nurse tried calling the prescription benefits provider, she was told the doctor would have to arrange a peer-to-peer call with the medical director to appeal the denial. So late that afternoon, at the end of the clinic, I called the appeals line and was put on hold. After 5 minutes, a clerk asked her member number, who I was, and why I was calling. I described the scenario and was serenaded with music. I put the phone on speaker and started writing that day's office notes in Epic, hoping that it's something productive while I waited. 30 minutes later, hello, this is Dr. Smith. How can I help you? Came through the speaker. I introduced myself and once again described Betty's clinical scenario. When I got to the request for diazepam, Dr. Smith's response was, well, you know that's on the Beers criteria list for risky drugs in the elderly. Yes, I know that. I teach geriatric prescribing to medical students and residents, and I recounted why I had not gone through the prescription benefits plan official policy. Well, diazepam is a very dangerous drug in the elderly, he said authoritatively. I understand that, but she had received a total of 600 pills in the 17 years I've been caring for her. The last script was 7 years ago, and she's never shown any signs of abuse. He responded, I'd be very worried if I was prescribing that to her given her age. I looked over at Susan, my nurse, who was clearly enjoying having someone else have to deal with phone calls. Let me ask you a question, I posed to Dr. Smith. You mentioned that you were worried that you were prescribing this to her. When was the last time you practiced clinical medicine, and what field did you practice? I was angry that a faceless physician, now administrator, was interfering with my attempt to provide clinical care. Susan tried to stifle her laugh. That is completely irrelevant to the situation, he replied. This medication is not indicated for this patient. I responded, so you're telling me how to practice medicine? Dr. Smith replied, no, I'm simply telling you that insurance will not allow her to have diazepam. By now, I had waited 45 minutes of my time that I would never get back. I was done and angry. Dr. Smith, At one point, you have taken the Hippocratic Oath, but now you have obviously forsaken it. You are the reason why physicians are burning out, leaving practice, and committing suicide. And I dropped the phone to the floor. In a loud voice, Susan yelled,
"My God, he's finally done it."
I don't know what happened to Dr. Smith, but Stu started laughing hysterically and pointed at her computer screen, which read, Walmart, pharmacy, generic diazepam, 2 milligrams, 60 pills for $6.70, no prescription plan necessary. Thank you.
Dr. Kaplan drops the mic. I love it. That's great. He's, my God, he's finally done it. Man, I imagine that many of you listening and many of you panelists, future doc students on here have gone through that or will go through that. I love how you interpreted the theme. Thank you, Larry, for doing that. Very much for sharing. Okay, moving on. Next up, 8th in line is MD Krieger, future MD, Michael Krieger. I loved it's Michael D. Krieger, so I love to say MD Krieger, future MD, soon to graduate. Michael has been a big supporter of narrative medicine also. And the idea for this story also sort of springs from his literature and medicine elective. It is titled Batman and the Doctor. Dr. Krieger.
All right, Batman and the Doctor. My father is a doctor. My mother is a nurse. As I was growing up, it seemed like my father was always working. He wasn't at all my baseball games like the other kids' dads. He was gone when I woke up in the morning, and when he got back in the evening, it seemed he only cared if I had done my homework. On the weekends, he would often spend long hours in his office working. I certainly did not want to be a doctor. I always liked science and math, and to a 9-year-old, it seemed like the only job out there for people who love science and math was inventor. I was also captivated by science fiction and superhero stories as a kid. So combining the two, it's no surprise that a favorite hero of mine was Batman. Everybody knows that Batman doesn't have any superpowers. He wasn't from Krypton. He wasn't born with the mutant X gene. Instead, he had a brilliant mind, and with his mind, he was able to invent, to build amazing gadgets and vehicles, to fight crime, and to help people. Perhaps if I were a superhero, I would be liked by my classmates too. But I wasn't really liked. I wasn't popular. I didn't have many friends. I was short, scrawny, buck-toothed, freckled, four-eyed, food allergic, and asthmatic. I was a nerd and I was annoying. And I was Jewish. The town I grew up in, Hingham, Massachusetts, was a predominantly Irish, Italian, Catholic, Anglo-Saxon Protestant town. I didn't understand why everyone else in school had a Christmas tree and we didn't. I mean, when you're 10, all you want to do is fit in, to get picked to play football during recess. I never got picked. Then the summer before I turned 13, I went to a Jewish sleepaway camp, Camp Eisner. Eisner was the first place I felt like I fit in, like I belonged. I still wasn't popular by any standards, but at least here I was surrounded by a lot more people like me. Nerdy, silly, not super athletic, and Jewish. Over the next 4 summers, I came back as a camper, and then 6 summers after as a counselor. Camp was where I made some of my best friends who I still talk to today. It's where I began to feel more comfortable with myself. To me, being Jewish has never been about some belief in a higher power, but it's been about community, connecting to those whom you love and to those around you, and about being a good person. Many of the teachings are directly about being good and doing good, about helping people, about healing the world, about community service, and about friendship and family. In Judaism, there is no greater act than helping someone else. As a counselor, I learned to work as a team, to develop programs, to teach, to communicate, to problem solve. I loved helping make the campers and my other counselors better. I loved being a teacher and a mentor. I felt like I was where I was supposed to be. My passion for science and mentorship never went away. In college, I took a science-heavy course load, still unsure of what I wanted to be when I grew up. I began to think being a doctor might not be a bad idea. And so I started working as an EMT, thinking it would help me decide. I realized I liked it a lot, but I wanted more, much more, to be able to do more, to know more, that I really truly did want to become a doctor. Then, on the day of our white coat ceremony, almost 4 years ago, I sat with my new classmates listening to the keynote speaker, my father. As I listened to him give us his pearls of wisdom for the path we were beginning, it occurred to me that my dad had been like Batman the whole time, using his mind as a doctor to treat disease and help people. All of those childhood experiences now made sense. Those missed baseball games didn't matter because here he was at my white coat ceremony. He had shown up. If the past few years here at Temple have shown me anything, it's that I'm in the right place. Just like when I got to camp, I realized this is where I belong. This is what I was meant to do. Being an almost doctor has tied everything together. My innate hero complex, my love of science and adventure, discovery and learning, of mentoring and teaching, community and friendship, and, above all, of helping people become better and better versions of themselves. Medical school has drastically changed me for the better, and I will save that story for the next Story Slam. Suffice it to say, I have grown in immense ways. I love the career I've chosen, and in a few months' time, just like my father, I will be a doctor.
Dr. Krieger DeVee, thank you so much. You know, I'm going to miss you. Thank you for sharing that story. And, you know, if we picked a team, a narrative medicine teams at the Lewis Katz School of Medicine, you'd be among the first picked on our team. So thank you for sharing that great story. Beautiful. Next up, you know, one act is harder to follow than the next. These are all such great stories. Next up is Bishak Kamat, a radiologist and a regular Story Slam participant. I still remember his first story in which he recalled being only a medical student, but answered that fateful call at 35,000 feet, is there a doctor on board? And tonight's story, I think, is more of our time and more of the moment. It is titled Inclusion on a Snowy Day. Bishak. Can't hear you. You're muted.
Well, hopefully everybody can hear me just
yeah,
fine.
Good.
Okay, this is my third Story Slam, and hopefully it's a charm this time. So this story is about inclusion. So to picture the scene, you know, I was up looking at what we call cabin fever. If you Google that, up ice sculptures up near Scranton, which is a beautiful place. And I really wanted to see it. And so I went out there. And so you've got to picture the scene as I go out there and I come back. I love the ice sculptures. And it was kind of 5 o'clock and it was getting dark. And there's a meandering road coming into where I was living in Scranton. And I had a 2-wheel car. It was a snowy day. I did not have my car holder, you know, for the phone. And it was in an area where you lost the GPS. So I was clearly getting distracted between, you know, the phone and the car. I was going at like 20 to 30 miles per hour in this area, but I was freaking out because I lost my signal. I didn't know where I was going. And I also didn't really believe at that time what black ice was. I never understood what that was. And as you can imagine in the story, what happens is, as I'm turning into one of the side streets, I literally hit one of the black ice. Now, my car is in full spin. It's one of the most scariest experiences if you ever had your car spin like that, 360. And then I went and hit the bank on the side, on a snow bank. And literally, I'm like in one of those movie kind of situations where my car is like 45 degrees. You can imagine on a side road where cars are going maybe 15 minutes, would seem like half an hour per car. And my closest family members, my parents are in India. My closest family members are at least 8 hours away, and I have no friends in America. No, that's why I'm doing Story Slam. No, I'm just kidding. No, but okay, so that's the situation. And so I'm just trying to have you picture the scene. And so to be very honest with you, I didn't have any blankets. I just turned my heater on. I called Geico Insurance, okay, to try to bail me out. They weren't going to get there for like 3 hours. called my wife. And so here I'm stuck in the car. I can't even open my door. And I got to tell you, in sincerity, I was scared. And I was scared because I thought I was not going to make it. And it was going to be one of those slow death situations, right? Because you're stuck there and it's not going to happen fast. And I can't even get out. And it's quite cold out there. I don't even have gloves on. And I bring this story because now I'm in total mercy of another individual, right? And cars are going by, and don't mind you, I'm honking, but someone passing by. And I'm praying at that moment that somebody will stop. And lo and behold, two gentlemen who were younger than me at that time stopped their car. And without saying a word, I mean, it was a stop of the car. They pulled out, they seemed like they knew what they were doing mechanically way better than I did. They pulled a chain, hooked it onto my Toyota Corolla two-wheeler, pulled it out, and it went off the bank, ran onto the road. And it was like jubilation when that happened. But in that moment, I also had tears. Tears for the crisis, obviously. But tears because we always have this saying, because I'm in two countries, and we always have these sayings where people are always talking about, well, the Americans, you know how they are. And then you always have people saying here, how the Indians and how they are. And you always have this sort of cross-cultural dynamic. And here I am in the middle of a crisis, and two people where their color of their skin doesn't matter, the clothing on them doesn't matter at that moment, the status doesn't matter at that moment, the race at that moment doesn't matter. What matters are two humans or three humans in that situation of crisis trying to help each other, because that's who we really are in that moment. And it was a very touching moment for me, I tell you. And, of course, I did stupid stuff like, trying to offer them money. They didn't ask me for anything, to be very honest with you. But I told them, and they're probably laughing at that time, because, again, the second tears is what was getting to me. And I said to them, this is what you guys are amazing. This is what I wish many of my family members back home and the people back home got to see. What Americans really are about. What they go and help people in these situations. You are true heroes. And whatever I give you, it will not make up for what the situation is. So I guess the lesson in each of my stories, there's a lesson. The two lessons or three lessons I learned is, one is karma. You always hear about karma. Remember, I'm the same guy that helped somebody 30,000 in the air on the airplane, as Michael just told you. Today, I was the person on a bank at 45 degrees on a snow, situation, could have had a slow death, and would not be here if it wasn't for two individuals randomly helping me. Okay? That's karma. Number two is the power of us in situations, right? This wasn't about me. This wasn't about my power, my status, it's not about me. It was about us, people helping each other, putting some of the stuff aside, right? That was lesson number two. And lesson number three, I think, is this is what it's all about. This is in the COVID times. I think it just has brought up the best in us in this light, that we have to get beyond some of these prejudices and things like that and start being more inclusive of each other. So I think that's my story, inclusion on a snowy day. And I hope that brought some smile to everybody. Thank you.
It did. Thank you very much for sharing that. I'm so glad they happened by you. I wonder, and your message is such a great one. And Lord knows we need it in a divided, politicized world. And your point is great that, in the end, we're just people and we help one another. And it's a great message to send out. And thanks for sharing that. So we are 9 down, 3 to go, folks. Our next presenter is Angela Rocky, second-year medical student, also a faithful participant in our student narrative medicine workshops. She's had an eventful year, I'll say, and her story is titled Filling in the Bubbles. Okay, Angela.
Thanks so much. Every week, for some reason, I put on makeup to come to Narrative Medicine, and every week I start crying. So I appreciate all the wonderful, beautiful stories that precursored me, but I blame them for my highlight. Questions on medical exams are complicated. Paragraphs of information are bubbled down into A, B, or C. Simple answers that are anything but simple. 60-year-old female requires intubation with difficulty oxygenating on the ventilator. You noticed diffuse bruising to her extremities and petechiae throughout her oral mucosa. Vital signs, complete blood count, and flow cytometry results are given. Patient receives cytarabine. For which of the following complications is she at the most immediate risk? These vignettes include only the clinical questions. Once you've correctly made your medical decisions, the profound questions of care arise. What do you do when a patient has nowhere to go on discharge? How do you convince a mother, the one that won't listen, that her child needs these shots? How do you make someone trust transfusions as you feel their blood slipping under the bottoms of your shoes? As a second-year medical student in 2020, I was so concentrated on solving these problems, I didn't notice my own. I didn't notice the size of my tonsils until they were blocking off my airway. Stoked by a malignant biofilm I didn't recognize growing in my own throat until a clumsy endoscope bumped its way through. I never noticed the viscosity of my blood until I was coughing it into my sink, or the markers on my cells until I saw transfusion bags with my name and O positive. I got better. My doctor bubbled in all the right answers, but it took time. I was terrified I'd have permanent hearing loss and chronic nerve pain, the symptoms that answer convoluted questions, and on how emergent adult tonsillectomy might go awry. After a while, I got back to ignoring my systems, subconsciously denoting myself as unremarkable or within normal limits. In the back of my mind, I was scared. I had a table of long-term complications dog-eared in the pages of my brain, not fogging my decision-making or causing me active stress, just magnifying the complexities of these medical questions even further. This semester, I was back to school, back to posing questions about hypothetical patients when I answered a call from Be the Match. I was overjoyed to finally hear a medical question that seemed easy and straightforward. Will you donate your bone marrow? The only answer that made sense was A, yes. I didn't have to consider anything else. I don't know this person's name or illness. I don't know the million distractors that might describe them on a step 1 question stem, a benign heart murmur, a silent gene mutation, the list of uniquely complex social determinants of health. But I do know I'm a match. I know I can make his or her prognosis better. I took filgrastim injections for 5 days. The chemotherapeutic mobilized my stem cells for harvesting. I injected myself in both arms each morning, and it felt like cold fire, and it went in slow. I could feel every one of my ribs for the first time, my sternum, even the connecting bones of my fingers and toes. I just ached. But I was healthy. All my symptoms were my body doing its job. I was physically exhausted, but I'd never had more invigorated resolve. The day of the donation, a mere month after I said yes, 2 months after I was undergoing my own operations, I was a beaming tangle of tubes. The needle in my left arm was long and thick. It required a hard cast to keep my elbow straight and my veins still. My right arm had a smaller bore needle, which allowed me to move it, in theory, but in reality, it came with this unpleasant pinching and oftentimes set off an alarm because I excitedly wiggled in my seat. Then suddenly, the procedure was done. I was back home with my dog, and I didn't ache anymore. If it wasn't for the silver pin on my desk, a gift from a patient that I'll never know, you could convince me it was all a dream. And it was a lovely dream. A simple question with an obvious answer is the only thing any of us could ask for. Yes, I will help.
Thank you, Angela. That's beautiful. You know, as a writer and a journalist, a career journalist, I also love the clarity and the simplicity. I strive for it, and I love that you had a simple and clear question and easy to answer. And I salute you. You know, I applaud you for your donation, and maybe one day I hope you'll get to meet your donor. I mean, meet the person you donated to. Thank you. All right. Our penultimate storyteller is Jenny Shad, a third-year medical student. Let's hear it for 2022. I'm a big fan of Jenny's, and she submitted a wonderful essay last fall in our essay contest, which I hope many of you read. Tonight, her slam story is titled The Poster. So, Jenny.
Okay. Hi, everyone. A week or so before the peak of COVID-19 cases in Philadelphia, someone plastered a large poster across the front of a boarded-up row home on my street. Big block letters at the bottom read 1918. The poster was of a black and white photo of nurses and doctors sitting at a table, only their eyes visible above their masks and below their caps. In the background of the image, a smaller poster was superimposed over an American flag. It showed a nurse caring for a patient and the words, "If I fail, he dies," above her. Whenever I saw that poster, my eyes were immediately drawn to those words. Just before that poster went up, I started volunteering in the transport department at TUH as they were short-staffed during the COVID surge. Every day before I went into the hospital, I saw that poster. Every day when I came home, I saw it again. Every time I read those words, "If I fail, he dies." I saw those words as I walked behind stretchers, down halls, into rooms covered with tarp. I tried to shove the image out of my mind when I passed a fellow transporter pushing a body bag across the bridge to the morgue. Whenever a patient asked me a question, I thought of my future patients, and I heard those words, "If I fail, he dies." One day, I transferred a patient from Rock Building to a COVID unit in Boyer, a 94-year-old woman with thin, swirling braids, her tiny, fragile body engulfed by her massive wound bed. When I told her I was taking her to the COVID floor, her wrinkled hand grabbed my gloved one. She looked me right in the eyes and stated more than asked, "They're moving me because I'm going to die." My heart dropped out of my chest, but I forced all of my efforts on keeping my face relaxed, calm, unflinching as I replied, No, you're not going to die. It just means you need a different room where they can better take care of your new infection." What I said was weakly true at best. Her statement felt more true. With her age and conditions, might this virus very well kill her? Wasn't she on 15 liters of high flow with an SpO2 of 80? Had I not seen the morgue full of COVID bodies? Was I right to tell her no, she wasn't going to die? And I thought of those words hanging above the nurse's head on that poster. If she died, had I failed? I found myself feeling responsible for that tiny woman's infection, as if I, as a medical student, it was within my power to shield her from the virus, and the fact that she had gotten infected meant that I alone had failed. If I fail, he dies. I wanted those words out of my head. I wanted that poster torn down. The implication of the words on that poster from 1918 is that the responsibility for the patient's survival lies in the nurse's hands alone, and if he dies, the blame falls solely on her shoulders. I wanted to believe that this sentiment was outdated, that it was eradicated 100 years ago, but just as the flu that caused the 1918 pandemic still persists today, that burden on healthcare workers persists too. This year, healthcare workers have been heralded as heroes, the ones who will save the rest of society. This burden has been placed in our hands, and sometimes it feels in our hands alone. I still think about that woman with the beautiful swirling braids sometimes. I think about the way her voice trembled and how tightly she clutched my hand, how I could feel her fear hanging in the air between us. I think about how I was the one to break the news of her infection to her, how it was me she had directed the question of her life to. I don't know if she ever made it out of the hospital or if she became one of the 500,000 lives claimed by COVID. I wonder if I said the right thing. I wonder if I gave her false hope, and I feel guilty. I was not yet even a third-year medical student. Who was I to tell this woman anything about whether she lives or dies? I questioned myself for what I said. I questioned putting myself into a situation I wasn't qualified to handle. I feel like I failed her. Then I have to remind myself that it was not my fault that her or I was in that position. I have to remind myself that the government and many citizens refused to do what was needed to stop hospitals from overflowing, and that I was in that position as a direct result of those actions. I am tired of healthcare workers having to be heroes. We are not superhuman, and asking us to be is to set us up for failure. We have given above and beyond, but without the full support of our government and our fellow citizens, it was too much for us. I have to remind myself that as healthcare workers, we did not fail that woman. It was her country that failed her, and it failed us too.
Wow. Thank you. Thank you for that, Jenny. Very powerful. People in healthcare have carried so much and done so much. I appreciate your perspective and your honesty and your willingness to share it with us. So thank you. And that leads us to our last storyteller. And certainly not least.
Certainly least.
Certainly not least. Dr. Erin Kamak, formerly Dr. Naruski, has been working in the ICU and on the front lines of COVID since the pandemic began. Her story is titled "The Most Fragile Lungs in a Lung Pandemic." Dr. Kamak.
Hello, everyone. It's a very hard act to follow. All of them are. But I think it's convenient that Jenny and I are put up next to one another because we have similar stories. So you may have heard a version of the story, but I'm going to tell you the version that's for healthcare workers because we're really different. And the most fragile lungs in this pandemic that I think are fragile are mine because of what this has put me through and put so much of us through. So I want to talk with you about how my experience of the pandemic has changed over the last year and in the ways that I hope it doesn't continue to change. So when this began at the peak, March last year or so, initially I was pretty separated from the suffering that the patients were going through and the suffering that a lot of our team members were going through, including the nurses and the fellows who were doing most of the hands-on patient care. As an attending, I was just a little bit insulated. And then, a few weeks in, things really got crazy. And it wasn't possible for me to be in a somewhat insulated position with plenty of time to get all the PPE on and go in and see the patient to accomplish exactly the goal I was there to accomplish and then get back out and teach in a safe space. Those of you who are in the hospital remember that there were sheets of plastic holding the rooms apart from one another, that people were spending sometimes weeks in what felt like little plastic bubbles, that the bubbles weren't wired for television, they weren't wired for phone, that sometimes there wasn't enough power, that IV poles tubing was running out because we were using tubing extension to get between the IV pole outside the room and the patient on the inside of the room, that we were using transport stretchers for people to spend weeks on that aren't designed to be cushioned in such a way as for someone to be comfortable, that patients were miserable, that they were tired, that it wasn't the same hospital that we are used to working in. And it was difficult for all of us, I think, to maintain our cool. And so during the first wave of the pandemic, for me, the very hardest moment occurred when the depth of staff between me and some of these really hard experiences broke down enough that I found myself in one of those bubble rooms in what used to be the cardiology clinic with a patient who had been discharged from the ICU only 45 minutes prior after having survived an ICU stay that was on the long end for patients that we'd had so far. One of the first comers to our brand new coronavirus ICU that used to be a neurology ward that's somehow now an ICU. And so this man had been through mechanical ventilation for a long period of time, and he had survived, and everyone was very excited for him. And there were many smiles and distanced high fives for him on his way out of the ICU, and he was transferred to the floors, which was this room that was a bubble of plastic in what used to be the cardiology ward. And I was there to see him because as soon as he hit the floors, he didn't look so good. And so I go down there to see him because, of course, the fellow is knee deep in something, and I'm the right person for the job. And so I go down there and I see him, and he's very close to coding. And we don't have a monitor, and we don't have a code card. Oh, we do, but we don't know where it is. And oh, here it is, but we don't know how to plug it in because there's nowhere to plug it in. And oh gosh, you know, and it's me and the bedside nurse, and she's an orthopedics nurse. And so this is all very new to her. And I'm trying to establish access, and I'm trying to get someone down there to start an airway, and I'm trying to communicate and also sort of run a code and also try to talk to this patient who's semi-conscious. And when his heart stops, I'm the one that's there to do CPR. And so I did CPR for a very long time, myself and the nurse trading off a minute at a time. I ran the code and did the CPR, and ran the code and did the CPR, and the patient died. And when it was over, I was exhausted and covered in sweat, and I had an N95, you know, digging into my face, and I couldn't see because I was so foggy under my glasses, and I was just sitting on the floor outside of the bubble room in the cardiology clinic, what used to be a cardiology clinic, and I was just collecting myself. And the fellow appeared in the cardiology clinic to check on me because I hadn't answered my phone, and said, "Hey, did you see what's going on in Harrisburg?" And he showed me some photos on his phone of these people who were maskless and standing on the front steps of the Capitol protesting the mask mandates and the lockdown and the procedures for public safety and health and social distancing, who carried signs that said COVID is a scam and don't be a sheep. And I had a very difficult day after that. It was hard for me to maintain focus. It was hard for me to talk to other people when I realized the way that this was going to go and how it was going to be. And I have to admit that there was some part of every day during the beginnings of this time when we were seeing so much suffering that were hard for that reason, particularly as the news continued to roll in. And what's hard for me now is different because there is room for hope, and there are vaccines rolling out, and the numbers are going down. But the experience that I'm having now is watching the patients that I care for in the outpatient realm, people with interstitial lung disease who are so incredibly fragile, receiving their COVID diagnoses and lighting up my inbox with positive results because it seems safer, because the numbers are down, because the vaccine is rolling out. Their mortality rate statistically is 10 times the national average for their age. Their chance of being hospitalized is 8 in 10. The devastation that this is wreaking on them right now at the end of the pandemic is reaching me in a different way. My inbox is lighting up for patients that I can't go see because they're in hospitals around the region, people whose bedsides I don't have the privilege to be at. While we're hearing that the Texas governor has decided to open Texas. And surely we here in Pennsylvania will not be insulated from the decisions of our public health officials as things continue to improve. And so I am still holding on in the same way that I was when I was sitting on the floor after CPR for 45 minutes, looking at the pictures of the protesters on the front steps of the Capitol in Harrisburg. It's just coming to me silently, alone in my office, getting epic notifications in an impersonal way. But it's still going on, and the most fragile among us still need us to behave as we should have the last time that it was March. So thank you for the opportunity to be here and tell that story.
Dr. Nawruzki, or Dr. Kamak, forgive me. Thank you for sharing that heartfelt, amazing story. You know, if storytelling puts you somewhere, you sure put us there in that room and on that floor with you. So that wraps up our stories. In a moment, you will get a poll from Daryl, our wizard, who is running the show, and you'll get 2 polls actually, with each poll has 6 on it, the 12 of you, the 12 storytellers, and you get to just get to pick one storyteller, you out there in Zoom land, and it's a very difficult choice. And pick the one you like the best and send it in. Now, really, all of you did a fabulous job, and I'm grateful to you all. I know the listeners are grateful to you all. I'm so glad this has been recorded and that others can watch it. The depth, the range of stories is fabulous. So take a few minutes, share these. The winner will get the opportunity to go to present at the Citywide College of Physicians Story Slam this year. I have Temple Bookstore sweatshirts for the first, second, and third place winners, which we'll meet up and get to. But right now, I'll be quiet, take a few minutes. We'll give everybody 3 or 4 minutes to think about it and pick your winner. But really, all of you, I don't get to vote, and I'm glad I don't, because it would be an impossible choice. Thank you all. Hang on, we'll have the results in a moment. Tie for second, or a tie, third and second were a tie. And those 2, I wish I had a drum roll or music or something, were Dr. Kamak and Jenny Shad. The last 2 presenters, 11 and 12, were tied for second and third. So congratulations to you. The voting is very close. There's lots of votes for everybody. Thankfully, the poll does the counting for me. So otherwise, it'd be taking a long time because they're all really close. And the winner, repeat champion from her first year in med school, is soon-to-be Dr. Katya R. for her story, Untitled. So way to go, Katya. But, really, all of you, from first to last, from Dr. Edithel to Dr. Kamak, all the way through, they're beautiful. And I have to say, this was consistently, by far, our best story slam yet. The stories were so strong. It was really fun to do. Daryl, thank you. I wish we could have conversation and continue this somehow, but it's 8:00, time to have a cocktail or watch the Sixers or study for your step or whatever you're going to do. And good night, everybody. Thank you for joining us for the 2021 Zoom Story Slam.